Pillar 3 aims at strengthening social protection systems in St. Lucia. Undoubtedly, the impact of the COVID-19 pandemic will be most severely felt by individuals and households who were already marginalized and vulnerable in the first instance prior to the onset of COVID-19. Consequently, this threatens to plunge such individuals even further into poverty and indigence, something that St. Lucia can ill afford at this moment. To put in context, as per the 2016 Country Poverty Assessment, the monetary poverty head count in St. Lucia was estimated at 25.1%. That is, 1 in every 4 St. Lucians is considered monetary poor. To shield these households from the impact of COVID-19, the government of St. Lucia has taken the bold step of expanding the number of poor households on St. Lucia's Public Assistance Program, commonly referred to as PAP, by an additional 1,000 households. This intervention will deal with the chronic undercoverage of social assistance programs in St. Lucia, as well as the anticipated increase in demand for cash transfers as a result of COVID-19. Priority attention will be given to the households that are currently on the waiting list, as well as households who were unemployed pre-COVID-19 and are now in desperate need of public assistance support. It must be noted, though, that this initiative will be implemented using the revised St. Lucia National Eligibility Test, or SLNet 3.0, to ensure that households who will benefit from this expansion exercise are those who meet the selected criteria. Additionally, the government of St. Lucia will increase the cash transfers to over 280 households receiving child disability grants from $200 to $300 monthly. A similar top-up will be provided to the 183 households receiving foster care grants, while the persons living with HIV grants will be increased to $200. To ensure that poor households have the necessary personal protective equipment, COVID-19 hygiene care packages will be provided to the indigent and vulnerable. The Ministry of Equity, Social Justice, Empowerment and Local Government, through the primary healthcare facilities and local municipal offices, will supply a total of 6,000 hygiene care packages, inclusive of masks, sanitizers, and sanitary napkins to the poor and vulnerable. The fourth intervention under this pillar is the provision of microfinance loans to households dislocated by COVID-19 to diversify into macro and small enterprises, as well as cottage industries. The Ministry of Equity, Social Justice, Empowerment and Local Government, through the James Belgrave Micro Enterprise Development Fund, will provide up to $500,000 in microloans to households with persons desirous of starting small cottage businesses. The government will also introduce a public works work fair entitled Rural Community Small Projects Economic Stimulation Initiative, which will stimulate economic activity at the community level to create employment and support household income during this trying economic period.